Hello, everyone. Welcome back to our session. This time, we're going to be talking about behavioral change, how to engage your patient. Again, I have nothing to disclose, and what we will be talking about when it comes to engaging our patient is in the premise that we are going to follow these six principles or six pillars of lifestyle medicine to improve the health of an individual. So in other words, our way of engaging people would be for the goal of helping them eat better, helping them move more, be more physically active, manage stress, maintain good relationships with other people, sleep well, and of course, avoid risky substances. Also, I am going to be explaining this to you with me assuming that you also have an understanding of the trans-theoretical model of change. So this aspect of engaging our patients should be, we should be doing this in any of these stages, okay? It doesn't matter whether the patient is in the pre-contemplation stage or whether the patient is in relapse. The approach to engaging your patient should be the same in any of these stages. So of course, knowing what stage your patient is at the moment you are talking with a patient is a completely different topic. But right now, the topic that we will be focusing on is actually doing motivational interviewing. And hence we go to our objectives. The objectives of this talk is to define motivational interviewing, or MI, identify the tasks of MI, or motivational interviewing, not myocardial infarction, okay? Describe the spirit of motivational interviewing, define the principles of motivational interviewing, and finally, identify motivational interviewing techniques to help patients actually change. So by using motivational interviewing with your patients, this is how myself as a lifestyle medicine physician, this is how we actually engage our patient and help them to change their behavior slowly, but definitely surely. So I also want to mention is that a lot of what I will be talking about is from this book, Motivational Interviewing, Helping People Change by William Miller and Stephen Rolnick. And they actually defined motivational interviewing as motivational interviewing is a client-centered directive method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. So when people aren't sure about what they're doing, that is where motivational interviewing comes in handy so that you're able to guide the patient to actually change for the better rather than change for the worse. So the tasks of MI are the following: engage through having sensitive conversations with patients. So you're wanting to come down to the level of the patient and you're wanting to be sensitive to what the patient actually needs rather than you telling the patient what to do or what not to do. Also, you want to focus on what's important to the patient regarding behavior, health, and welfare. So you may know what the patient should do, but when you do motivational interviewing, when you want to engage your patient and actually help the patient improve in their behaviors for the better, what you want to do is to really listen carefully to what the patient needs and why the patient sees certain steps towards good behavior maybe daunting or maybe scary or whatever, however the patient feels. This is for you to understand, and by so doing, evoke the patient's personal motivation for change, okay? Of course, after doing that, then we negotiate plans. So it is in an interview that is motivational interviewing, when you engage in dialogue with the patient, we always want to put the patient in mind. What does the patient feel and how we can motivate the patient into seeing the change as a positive thing. Okay, motivating often means resolving conflicting and ambivalent feelings and thoughts, and this is basically the task that we want to do for when we do motivational interviewing with our patients. So the motivational interviewing spirit, Blaise Pascal said, people are generally better persuaded by the reasons which they have themselves discovered than by those which have come into the mind of others. So basically what we're saying here is you want to allow the patient to discover that he or she actually needs to change, so that in terms of behavior, so that he or she can improve his or her health. Okay. So the spirit of motivational interviewing, it is a way of being with patients that is collaborative, evocative, and we're going to be going through each of this through this talk, respectful of autonomy, and of course, compassionate. Okay, so let's start with collaboration then, not confrontation. This is an emphasis here. We want to collaborate, not confront the patient, not to be condescending upon the patient, like, okay, this is going to kill you. This is what you should be doing. Okay, we don't want to be that. We want to be a collaborative person, and we want to collaborate with our patients. So developing a partnership in which patients' expertise, perspectives, and input are central to the consultation. So you really want to listen to what the patient has to say. Fostering and encouraging power sharing in the interaction. So this is something that we will be discussing throughout this talk. So evocation, not education. I know that what we as doctors want to do is to educate our patient, right? But there is a right time when to educate a patient, and that is when the patient is receptive, and that is when the patient has already figured out that he or she does need education. But before that happens, what you want to do is have evocation rather than education. So this means motivation for change resides within the patient. In other words, the patient now desires, because of how you talk to the patient, because of how you elicit the feelings of the patient, and how you discern what the patient really needs and what the patient really wants, the patient's goals, in other words, then you allow the patient to be motivated from within. So the patient is now self-motivated rather than you pushing the patient to do something. So motivation is enhanced by eliciting and drawing on the patient's own perceptions, experiences, and goals. And that is why we want to always recommend asking open-ended questions, asking key open-ended questions. Okay, so that is what we want to do. Also, we want to respect the person's autonomy, the person's being in charge of himself. Respecting the patient's right to make informed choices facilitates change. And that's what we want to do when we do motivational interviewing. The patient is in charge of his or her choices and thus is responsible for the outcomes. So if the patient is open enough to actually listen to you at this point, then the patient, as you speak to the patient, as you tell the patient certain things like present studies, etc., then the patient can now realize that, oh, okay, the choices I make actually result in certain things. And by helping the patient realize that his or her choices decide or determine certain outcomes, then you're empowering the patient to really make the choices for him or herself. So emphasize patient control and choice. Okay, the patient is in charge of his or her health. The last part that we want to talk about when it comes to the spirit of motivational interviewing is compassion, empathy for the experience of others. Okay, as a physician, you have to be able to put yourself in your patient's shoes. I know while we were in medical school, we were taught to kind of be a little bit detached from our patient emotionally. But if you really want to have an impact on a patient's person and a patient's health, there has to be room for being empathic towards your patients, understanding how your patient actually feels if you were in their position. So you should also show desire to alleviate the suffering of your patients, of other people. And finally, belief and commitment to act in the best interests of the patient. So unless you're showing the patient you actually care, then of course the patient will not be able to open up to you. They will not be able to trust you at the very beginning. So it is important that your patient can trust you and that you show them that they can actually trust you by being compassionate, by being empathic, and by listening to them. So what motivational interviewing is not? Of course, we now know what motivational interviewing is, but sometimes we may be tempted to do some of these things, and this is not motivational interviewing. So MI is not a way of tricking people into doing what you want them to do, okay? This is absolutely not what motivational interviewing is. It is not a specific technique. It is not problem solving or skill building. It is not just patient-centered therapy, and it is not easy to learn. This is something that we have to understand at the very beginning. It is not an easy thing to learn. In fact, even though I've been doing motivational interviewing for about 10, 11 years now, I still stumble. You know, I still have to review certain aspects of motivational interviewing every time I face another day. Before I face another day of patient interviews, I have to review these things that I have to do for my patient in order for me to elicit a good reaction, of course, create trust between my patient and myself. So motivational interviewing is not a panacea for every clinical challenge. So not every clinical challenge requires motivational interviewing. So you have to know when motivational interviewing actually matters. So let's now go into the principles of motivational interviewing. So these are the 4 basic principles, and I'm going to show you that there's in some scenarios we actually say that there are 5, but essentially there are 4 basic principles of motivational interviewing. So as you interview the patient, you must express empathy. This is essential, and we already also mentioned that earlier on when using the spirit of motivational interviewing and having compassion for your patient. So express empathy, that is very important. You want to develop this discrepancy, and we're going to be discussing what that is in a little bit. You want to roll with resistance. So not everyone will be open to certain suggestions that you may have, but you have to learn how to roll with resistance, and I'm going to give you examples of how to do that. And finally, of course, we want to support self-efficacy. So some of the references that we have here is, again, Motivational Enhancement Therapy Manual. This is by Miller et al. Okay. So here in this slide, for example, we have 5 principles of motivational interviewing. And I got this information from an infographic from this case study of Hazelden Betty Ford in Plymouth. This person here, Hazelden Betty Ford Butler, this Center for Research, I should say, they use motivational interviewing to treat adolescents and young adults with substance use disorders. And as you can imagine, this is a very difficult job. So they actually added something which is also, I would say, part of rolling with resistance. Okay, so avoid argumentation and direct confrontation, which is essentially rolling with resistance. They just kind of emphasized it there so that maybe when you have the urge to really argue with the patients on a certain point, then this is to remind you that you're not here to argue with the patient. You're actually here to understand what the patient needs. And in so doing, You avoid arguments, you avoid direct confrontation, and you essentially roll with resistance, roll with client resistance instead of fighting it, okay? So let's discuss each one carefully. Express empathy. Sometimes you have to go to the extent of actually holding a person's hand, just to assure the person that you actually understand him or her. I know there may be some boundaries when it comes to physically touching your patient, but when you do so in an empathic way, not in a harassment kind of way, then they will definitely see the difference. And this is also why it is good to probably have a nurse with you who the patient also trusts, so that when you do have these conversations and these engagements with your patient, they will not be seen as a form of harassment and something that they will be uncomfortable with. It is really up to you as a physician to see whether the patient would be open to actually having your hand put on their shoulder as a show of you understanding the patient's feelings, okay? And here's a quick icebreaker for us, just to break the monotony. This doctor says, I think you'll find I'm one of the most empathetic doctors around, because he exactly feels what the patient is feeling. So a little bit of humor there just to break the monotony. So express empathy. What is empathy? Maybe you might be asking, what is empathy? Well, empathy reflects an accurate understanding of a person, okay? It assumes the person's perspectives are understandable, comprehensible, and valid. Seeks to understand the person's feelings and perspectives without judging the patient. And this is sometimes very hard for us to do as physicians. We have a tendency to judge the patient based on how we see them. Instead of putting ourselves in their shoes, we, as authorities in health, have a tendency to actually judge the patient. And sometimes we can express that very, very explicitly, which of course is the opposite of empathy. So we do not want to judge our patients. We want to understand them and try to put ourselves in their shoes and try to feel what they would feel if you were in their situation. So this is basically what empathy is and what we should be doing. So why is empathy important in motivational interviewing? It communicates acceptance, which facilitates change. You want the patient to change, then you have to show them that they are acceptable, that their weaknesses are acceptable, that it is simply being human to be weak in certain areas of life. So it encourages a collaborative alliance, which also promotes change, and it leads to an understanding of each person's unique perspective, feelings, and values, which make up the material we need to facilitate change. So once the patient understands that, okay, I need help and I want to change, and you showing them that you actually feel that and you actually understand that with the person, with the patient, then they will have better trust towards you as a physician. And when they feel that you actually understand them, then they will be more open to explore certain areas, certain ways to actually change their behavior for the better. So continuing on this topic of expressing empathy, here are some good tips, okay? Even if you don't feel empathetic towards a person, you know what? Just doing these things, physically doing these tips, can actually help the patient feel that you are actually empathetic with them. So good eye contact is something that you need to practice with your patient. Don't always be looking at your notes, looking at your watch, looking at your phone or other things. Have good eye contact with your patient as the patient is talking. Have responsive facial expression, like you actually understand the patient. Have good body orientation. Don't have folded arms or folded hands. Make sure you're facing the patient with more open type of body movements, body orientation, body posture. Verbal and nonverbal encouragers. You have to be aware of how you talk to your patient. how you move your hands, how you express your thoughts and your feelings through body language. Okay, reflective listening, asking clarifying questions. This helps assure the patient that you are actually listening to him or her and trying to understand him or her. And the last thing here is, of course, as I mentioned earlier, avoid expressing doubt, passing judgment on your patient. That will cause a barrier when you start expressing doubt and passing judgment. So what we want to do is simply improve our listening skills. And even at the beginning, it's hard to do this at the beginning, especially if you're not used to it. But as they say, at the beginning, you can fake it, right? You can keep faking it until you actually make it, right? Fake it till you make it. And eventually you will actually learn how to really, truly understand your patient by following these tips. Initially, it may be faking it, but later on, you'll notice that you're actually getting into this habit of actually listening to your patient and trying to understand them on their level. Okay, so the bottom line on empathy is that ambivalence, I should say, is normal. It's normal to doubt things. It's normal to not understand where your life is going in terms of direction. And when you show this to your patient, that it is okay to be doubtful, it's okay to not be sure about what they're doing, that is showing them that you understand where they are at. Number two, bottom line is our acceptance facilitates change. So when you accept your weakness as a physician, and when your patient accepts their weakness as a patient, then it is something that they can move forward from. Okay, it's something that they can build on. And of course, the last thing here is that skillful reflective listening is fundamental to expressing empathy. So even if at the beginning you don't, or you aren't truly empathizing with a patient, by using the skills, the tips that I mentioned earlier, you can keep practicing that until you finally are in tune. You are in kind of the zone, understanding how the patient really feels. And in so doing, by expressing that, then you're helping the patient be more trusting of you, and of course, help with changing their behavior for the better. Okay, we talked about develop discrepancy as one of the principles of motivational interviewing. And yes, it is helping the patient realize that 1 + 1 is actually not 3, okay? So it is showing the patient that there is some discrepancy between what their goal is and what they're actually presently doing. So when you develop discrepancy, it is showing that current behavior is not, there's a discrepancy between your current behavior and your future goals. So for example, sometimes when you drink during the week and say you can't get out of bed to work, last month you missed 5 days of work, but you enjoy your work and are doing well in your job, and doing well in your job is very important to you. So you allow the patient to realize that his or her job is important, but there are certain types of things in the behavior that have to change in order for him to act or her to actually reach their goal. Okay, so if the goal is to be really good at work and to keep the job, keep your work, then there are certain behaviors that the patient or the person has to realize that he or she should do so that he or she can keep that job. Okay, so it's simply just helping the patient realize that what they're doing now does not show that they're really wanting, or it is leading to achieving the goal that they have set for themselves to achieve. Once they understand this, then that can be a motivation for them to actually change certain behaviors so that they are able to achieve their goals. Okay, so the third principle is roll with resistance, right? Roll with resistance. And this concept, of course, initially was for how we could prevent injury. when it comes to certain falls, right? So we roll with resistance so that we don't injure ourselves. Well, the same principle is true when it comes to resistance in terms of motivational interviewing. So when we roll with resistance, here are some examples so that we can understand it better. So the patient says, I don't plan to quit drinking anytime soon, kind of adamant, right? Then you can say, you don't think that abstinence would work for you right now. It's like acknowledging, okay? It's acknowledging what the patient is saying, but at the same time, not putting a period, okay? Not putting a period to where the patient is at the moment. So you're showing that you understand where the patient is, but you're not telling the patient that this is the end of it. You know, you've decided that and that's it. So right here, the clinician simply says, right now, you don't think that abstinence would work for you, okay? So that means that is at present what he or she is feeling, but not necessarily what could be done in the future or what the situation will be in the future. This is another example. The patient says, my husband is always nagging me about my drinking, always calling me an alcoholic. It really bugs me. So the patient is angry. And the clinician, you as a clinician could say, you know what, it sounds like he really cares about you and is actually concerned, although he expresses it in a way that makes you angry or that really bugs you. So that is acknowledging that the patient is feeling angry, is feeling bugged by what the husband is saying, but it is also showing that, look, here's the other side to the coin. Your husband really loves you. Your husband really cares for you. The only problem is he's not showing it or expressing it in a way that you like, and that's why it gets you angry. So this is how we want to roll with resistance. And it takes practice. It takes a lot of experience. It takes practice. You can develop your own way of rolling with resistance when you encounter certain things that your patient will say that may be kind of negative. But once you are able to get a handle of rolling with resistance, then it'll greatly improve your ability to motivate your patient and engage your patient to adapt healthier behaviors and change unhealthy behaviors. Okay. So the last principle is, of course, to support self-efficiency. You want to empower your patient. Okay. And so patients are responsible for choosing and carrying out actions to change. So this is important. This is highly important because as you show your patient that their choices actually matter and that they are in charge of their health and that they can make choices that will promote health or destroy health, then you are empowering the patient. You are showing him or her that, look, you are in control. You can do this, okay? So just to kind of recap everything, okay, and these are the four guiding principles that you want to take into mind as you do motivational interviewing so that you can engage your patient and so that you can help them change their behaviors. Number one, resist the righting reflex. As doctors, we always want to, push or pull the patient towards what is right, what they should be following. If a patient is ambivalent about change and the clinician champions the side of change, then we want to resist the righting reflex. Try to understand, acknowledge the patient rather than tell the patient that she or he is wrong and that this is the right way to go, okay? It's very tempting, especially that you know what the patient should be doing, but let us resist the righting reflex. Number two, understand your patient's motivations. So with limited consultation time, it is more productive asking patients what their reasons are and why they choose to change rather than telling them they should, okay? Now, this is one reason why in lifestyle medicine, we actually have longer consultation periods with our patients. On one-on-one consultations, I spend about 30 minutes minimum for each patient because I want to truly understand my patient. there's really no shortcut to it. If you really want to understand the patient's motivations for changing, you have to sit down with your patient and give them time. So 30 minutes is the advice, at least, to listen carefully to your patient. As you get more skilled at listening and helping motivate your patient, of course, that will shorten over time, especially if the patient keeps coming back to you. Then, of course, you already have a good relationship with your patient by then, and then you can help, motivate and move the patient towards better behavior, healthier behavior. So number 3, always remember, you have to listen to your patient. I know you're always, as physicians, we're always in a rush to get the next patient and to address the next patient's condition, but you have to be disciplined and you have to give time to your patient to listen to your patient. When it comes to behavior change, the answers most likely will lie within the patient, and finding answers requires listening. So it is absolutely important that we listen to our patient. Number 4, last point here is that you want to empower your patient. So a patient who is active in consultation, thinking aloud about why, what, and how of change, is more likely to do something about it. So when they are able to answer these questions out loud and they are able to share it with you, then you know that your patient is on the right track. And you want to keep empowering your patient, because by doing so, you motivate the patient and you literally engage the patient in his or her health. So when it comes to lifestyle management, lifestyle medicine is always a two-way street. It can't be you telling the patient what to do. It also has to be the patient telling you how he or she feels and how he or she thinks they can actually solve the problem. So sometimes the solution to the problem lies within the patient. And it is how you motivate the patient, how you use motivational interviewing, that you can engage the patient and encourage him or her to actually make that change. So conclusions for the basics. Remember that motivational interviewing is an evidence-based intervention. It provides structure to the consultation and readily adaptable to healthcare and other settings. So we want to be evidence-based, and we now know that motivational interviewing really, really helps and ramps up this engagement, this doctor-patient engagement, and it helps the patient lean towards changing for the better. And of course, when you see that change in your patient, it is really even for us as physicians, it is motivating for us to see our patient do better and better. This is where the fulfillment comes when it comes to treating our patient, to see that your patient is now independent and knows what he or she has to do to become a better person, to become a healthier person. So thank you very much for your time, for listening, and I am ready to accept questions.